Hello everybody, welcome back to my channel. My name is Vivian. So today I'm going to be doing a video as requested of the competencies you require to go out there and work as an agency nurse to make your hard-earned money, okay, and to get some extra income as a nurse in the UK. So this is a very important topic because apart from making money, you need to ensure that you're doing the right thing, doing your job competently, and not causing troubles wherever you go for your agency jobs. Okay, so people come to places to work as agencies and actually do not know anything about the department that they are going to work in, which is very wrong. So it's something that's very vital to talk about. So if you're interested in this, do stick right to the end. So if you're an agency nurse during your registration process, usually you're requested to inform your agency of your skills and competency. And generally, you have update courses and mandatory courses which your agency is going to sign you up for, or which you can submit from your trust, which you've done, things like manual handling, fire safety, infection prevention and control, conflict resolution, things like that. All right, so these are basic things that are required from you as a nurse to know before you start any job. Okay, they are called mandatory training. Okay, now for specific skills, okay, you're also expected to inform your agency of the department where which you are working. Now your agency now will base off your application in allocating you to places to go work, be it trust or care homes. Now the most basic place where you can work as a nurse without troubles, I believe, should be a care home. All right, because in a care home, the basic skill which you're expected to understand is safety, manual handling, conflict resolution, medicines management, referral, escalating, and transferring of patients to the hospital when they are sick, and bereavement process in case a patient dies, and handling a call or calling the relatives if, for instance, a patient passes on during your shift in the hospital, incident reporting and handling over, and most importantly, documentation skills. All right, now these are basic things that you will require in working in a care home apart from other skills. Okay, so you should be competent in your drug administration, be competent in your incident reporting, be competent in documentation, be competent in conflict management, be competent in manual handling, because in the care homes you handle patients who may have complex cases, you handle patients who probably have reduced movement and mobility, you handle patients who have a lot of complex needs, okay, and you have a lot of them who have falls, okay, who have broken bones or who are high risk of fall. So that is a skill you have to work in a care home. All right, so working in a care home, your basic nursing skills is important, and then specific skills that are needed for working in the UK. Okay, now if you come to the NHS, this is where it becomes very dodgy. Outside your medical, nursing, and surgical experiences and knowledge, you may require specific skills to work in specific departments in the NHS. For instance, if you are working in a medical ward, a stroke ward, a diabetic ward, a drug misuse ward or something, now there's some specific processes that are relevant to that department. So that is why it is important to let your agency know that you are working in a medical ward, and they will align you with medical ward jobs in other trusts. More often than not, the skills required in the medical wards are usually universal across trusts. Even if there are differences, it's going to be limited differences and slight differences, but at least you will not be lost. For instance, if you're giving medications like gentamicin, you know that you require to have levels. Okay, now that is a standard thing. Okay, and then so you will just be different that in this trust they require you to wait for the levels and get it prescribed, or in some trusts they just expect you to check the levels, and if you're happy with the levels, you give the medications. But in some trusts, you may be required to wait for the doctors to prescribe the medications before giving. So you have to find out what is the protocol. Now, in every trust, there are usually standard operating procedures. Okay, you have the medicines guidelines online, the systems, the medical systems, the laboratory systems. Okay, so you have to try to be familiar with whatever is in the trust that you find yourself. Okay, medicine management is standard, it's always the same thing. You have to do your due diligence in medicine administration, ensuring the rights of medical administration, ensuring that the patient is safe before you give, ensuring everything, right patient, right drug, right rules, right everything. You have to ensure all that is safe before you give any medication. Now, for specific things that relate to the department, now you have to find out from the people you're working with. And if you're working in the medical department, for instance, then it's going to be easier for you to fit it into a medical ward if you are posted to a medical ward for an agency work. For instance, also if you're in the surgical department, you be expected to know some specific skills. For instance, using your syringe driver, your PCA, epidural, monitoring, things like that. Okay, if it's a colorectal place, you have to talk about stoma skills. Okay, talk about IV access, central line access, PICC line care, administration of TPN, administration of feeding, okay, parenteral feeding, and the likes of that. Okay, if you're in a elderly ward, you can be thinking about things like end-of-life care, caring for patients in end-of-life, use of your syringe driver, use of your PCA machines, specific things that are specific to departments. If you're going to an oncology ward, I expect that you have worked in an oncology department and you know what is expected in monitoring patients, their blood levels, use of steroids and things like that. Okay, so pain management, okay, just like things like that. Now, for instance, if you are in an orthopedic ward, then you should be thinking about things relating to orthopedics. Okay, moving of patients, tests after 24 hours, okay, urine outputs, monitoring of urine, be competent in using your bladder scanner. This can be applicable to your surgical ward also. Now, these specific things, okay, are specific to wards. If it's, for instance, a medical ward, like a respiratory ward, then you should be thinking about things like the CPAP, BiPAP, okay, oxygen administration. Things like that are specific to medical respiratory wards, okay, and use of medication. So depending on which departments where you are sent for an agency work, that should determine the competency that you're expected to have. Mind you, it's not just about making the money. You have to be giving appropriate standard quality care, and remember, you're liable if anything goes wrong. So if you're not sure of anything wherever you're sent for an agency work, instead of you to just dabble into it and go do what you don't know, just tell them that you are not competent or you are not comfortable doing this role, and they will leave you alone and get somebody else to do the role, instead of you to go ahead and do that role and then something goes wrong at the end of the day. So you don't want to go ahead doing things that you're not comfortable or competent doing. Okay, there is no problem not knowing how to do something. The only problem is you going to do it and everybody thinking you know how to do it, and then something goes wrong, then you are liable. For instance, in the cardiac work, you're not comfortable with cardiac monitoring, you're not comfortable with basic cardiac monitoring, and then you go ahead to go to a cardiac ward to work, and then something goes wrong with the patient on the cardiac monitor, which you're expected to notice, and because you don't have any knowledge of cardiac monitoring, you do not raise an alarm, then you are liable for negligence when something goes wrong. So working in an agency is good, all good with the money and everything. However, you have to be careful that you're doing things according to your skill and competency. Some agencies are very good at this. They're able to ask you what you can do and where you have worked in the last 6 months or 3 months, just to be sure you're confident in what you're doing, and they put you in those departments where you say you have worked in the last 3 months. That helps you to streamline your competency and your skill in that place. Okay, things like catheterization, basic things. Okay, IV administration, use of IV pumps, use of medicine management, pain management. Okay, little protocols, okay, are things that you're expected to know. Okay, there are standard protocols all over trust. They can vary from trust to trust, but somehow they are all streamlined. Okay, but some trusts can just make their own to be more specific to themselves. So this is where you need to have this knowledge and then streamline it to whatever it is that you find yourself. Okay, I hope that makes sense. So for skills that you need to work in an agency, it's just all your complete nursing skill, as a matter of fact. However, some departments have department specific skills which you cannot play with. Okay, for instance, you cannot even go work in a pediatric ward if you're not a pediatric nurse. However, like a mental health nurse, they would not even take you as an adult nurse to come and do agency work in a mental health department. But if your trust has a mental health facility and you as a nurse has gone there to shadow, or you have been posted there on a secondment basis and you've had knowledge of working in a mental health ward, now you can apply that knowledge to an agency role. However, the agency will understand that you're not a mental health nurse. However, you've had experience working in this department, and that is the same understanding that we have when they post you for a job. And those who are going to be welcoming you into their mental health facility, we knew that you're not a mental health nurse. However, you've had experience for X Y amount of months, and based on that, they are giving you this job. So they will be careful with the way in which they assign tasks to you. Once they know that you are not a mental health nurse, they'll be careful the kind of things they give to you to do. The same thing if you're in a department that you're not very comfortable with, or which you're not conversant with. As far as you've said it out that you're not comfortable doing this thing, and everybody knows that you are just a new nurse or just an adult nurse and not a pediatric nurse who comes to just help them in a pediatric ward, they will give you roles that are more suiting to you. For instance, in the pediatric ward, they may give you more teenage children to take care of, unlike little babies. Okay, so depending on the need wherever you go, depending on the need of your agency, depending on the need of a care home or the trust in which you are posted to, just know your competency. And when something which you're not comfortable doing is brought to you, just politely tell them, I'm sorry, I am not comfortable doing this because I do not have the adequate skill to perform this task. Okay, now, and you don't want to do anything that is going to put your pain in jeopardy. All right, so the safest thing for you to do is to work in the department that you're comfortable with, which you're working in presently, or if you're in a care home, working with people who are skilled, and that should keep you safe in every situation. I hope that makes sense. I can help you to understand the skills that you need. Okay, you need every nursing skill. Every nursing skill that you acquire in training, in study, in practice is relevant in your practice as an agency nurse. However, there are specific places where specific skills are required. Okay, places like ICU, pediatrics, surgical, mental health, elderly care. There are ward specific skills. Okay, cardiac ward, orthopedic wards, cath lab wards. Those things are specific, so you have to have had experience, or even if it is telemedicine, okay, or colorectal, whatever it is, you have to have the specific skill of that department. And the only way you can do this is to have worked in that department before. However, if you're posted to somewhere you did not know they were sending you somewhere else that you don't have skill in, when you get there, once you are faced with things that you are not comfortable with or that you do not have any knowledge about, speak out, voice out, don't keep quiet, and don't go ahead to do that. They will definitely find something that is more suiting for you to do during that shift of yours. Okay, just make sure that you are safe and that while you're making the money and putting money in your bag, you're not putting your pain in jeopardy. Because even when you leave, if anything goes wrong, they will always go back and call back to you. So it always comes back to you. So ensure you're doing the right thing and you're doing what you are comfortable and what is safe and what you're competent and skilled at doing. I hope that helps you in understanding the skills you need to work as an agency nurse and make your moolah. Thank you for watching. If you do have any question, do well to ask. I'll do my best to answer. I love you as always. Bye for now.